This is a myofascial release technique for the scapula. The positioning of the caudate hand is with thumb in axilla, fingers wrapping along the medial border of the scapula. The cephalad hand can either be here controlling both the humerus and the scapula. I'm controlling the humerus with my thumb, which works very well in the size of patient and with somebody who has minimal dysfunction. If somebody is larger, has more musculature, or has much more resistant tissue, I would actually use my forearm to direct this to spare my thumb and fingers, and then use my fingers and my thumb just to monitor what would be happening here. This technique can be done both in a direct and indirect fashion. To show you how one would do it directly, I would check planes of motion, looking for where is the greatest sense of restriction. Moving downward produces a lot more tension in levator scapula. I'm now going to do some rotation. Rotating downward now puts some traction on trapezius, and I'm now checking protraction and retraction, and putting her into more retraction actually puts more tension on pec major. Pec major attaches to the humerus, which is obviously connected to the scapula. There's also some tension on pec minor, which attaches to the coracoid process of the scapula. Now that I have her in this direct setup in all these directions, I can simply hold and wait for release. If I were to do this in an indirect fashion, I would move her to the position of ease for levator scapula by moving cephalad. I would move her into more of a downward orientation of the glenoid fossa, which would actually put a little bit of stretch on her trapezius, but it actually feels that there's more motion present, and I'm going to bring her into protraction to take the tension off both pec major and pec minor. I would hold this position until I would feel a release. Typically, when one does a myofascial release of the scapula, as those muscles release, you then are aware that there is tension in other muscles, and you will start changing your orientation of the scapula. I believe there's 17 different muscles that attach to the scapula, and it behooves you to take the time to release all of them. The advantage of doing this treatment is that you get a very nice release both from the occiput, where we have attachment of several muscles, all the way down to sacrum, where we have the attachment of the latissimus dorsi, as well as muscles on the anterior and posterior aspects of the torso and throat. Usually this is a pleasant technique, and if there is pain, you may be gripping your patient much too firmly. Additionally, by having your thumb in the axilla, you can actually sense subscapularis underneath the scapula, as well as serratus anterior running along the rib cage. One of the other complications of this technique, if it could be considered even a complication, would be that you could cause some numbness in the in the upper extremity, typically in the hand or forearm, simply because of the placement of the thumb in the axilla. You can try rearranging your grip. However, I find that it's better to conclude the technique and reassure the patient that the numbness will resolve quickly. It usually does within seconds of concluding the technique. Typically, that problem is only seen in those who need the technique the most.